So our children have not been going in-person school. It's been all Zoom school for them. But there's been a mix. There's been some schools that have been open and some that haven't. First of all, what in your practice in Oak Park, what's the mix? Have you seen that a majority of the children are in person versus virtual?
So it's actually pretty interesting. I get to see a mix of situations because my practice is actually just outside of Los Angeles. So we have a fair number of kids that or families that live in Los Angeles where public schools are closed or sorry, in-person learning is closed. It's all Zoom learning. And then there's a fair number of private schools as well as public schools that are just starting to open. And so I get to see a variety. I think a lot of families have different experiences and different concerns about going to school. But I think the vast majority of kids that are now in in-person learning, the parents are so happy. They're seeing their kids' behavior improve, their happiness improve. And so it is interesting to see that juxtaposition of different family situations.
Mm-hmm. So right now the coronavirus cases are surging. And so it may seem like a funny time to talk about reopening schools, although certainly some schools in many parts of the country have remained open.
Yes.
Let me just start with, at a basic level, if schools are to open, what are the simple things that can be done to minimize the risk?
Okay, so and I think you're asking the question that's on everybody's mind. We're so desperate to get schools reopened, but at the same time, numbers are going up. So how do we reconcile that? But yes, I do think there are a lot of simple things we can do to ensure safety or minimize harm, and that would be to encourage mask wearing, keep kids at a distance, provide proper ventilation for rooms, and get the kids outside whenever possible. So I do think it is possible to reopen in a safe manner.
Yeah, and certainly other parts of the country where it's a lot colder, being outdoors during the school day may not be realistic. I mean, we're very lucky here in California,
right?
And ironically, here in Los Angeles is one of the places that's been most conservative about keeping the schools closed. One thing, we do have little kids. We know from personal experience, it's not easy to keep the masks on them. How important is that? And do you see that as feasible to keep the masks on children?
I do think it's feasible. I think kids are pretty compliant. I think at first when we were encouraging mask wearing amongst kids, I wasn't as sure, but I really see kids following. In our office, we have a rule that kids do wear masks when they come in the office, and they comply. They're able to keep their masks on. So I definitely think, while it might not be perfect, especially with the younger kids, I think it is absolutely possible.
Yeah. So I'm embarrassed to say that our kids are not the easiest to keep the masks on, but I do think it's possible. And part of the reason I think that is we actually took a family trip to Japan before the pandemic. So this was even pre-pandemic. And many of the children in Japan were wearing masks. And certainly during this pandemic, in the places that have open schools, in Asian countries, in many parts of the US, they have succeeded in getting masks on kids. I also think that our kids would probably do it more consistently if they saw their friends around them doing it.
But I think what's so interesting is when you look at schools that have remained open, it looks to be really safe for both the children and safe for teachers. I haven't read about a teacher that has gotten sick enough to pass away from a student. So while teachers have come down with the coronavirus and been sick from it, I have not yet read about a student that has passed it to a teacher where they have done poorly. So I might be missing something, but I think generally when teachers have been ill from COVID, it has not come from a student, it's come from another adult.
Yeah, so there's been an interesting observation that coronavirus certainly does spread from adults to children. But it seems, I think there was a pediatric study over the summer that showed that it's only very rare, maybe 10% of the time or less, that kids get it from adults. What do we know about the transmission between kids and adults versus into kids?
Yeah, so this is what I think is so fascinating about COVID, because this is totally different from other viruses in my experience as a pediatrician. For example, the typical flu or the typical cold, usually kids are petri dishes, or they're the ones that spread the virus and then pass it on to their grandparents, their adults, or those that are more vulnerable. But what we're seeing with COVID, which I think is really wonderful news, is that kids really aren't spreading it. It's possible. I mean, they do get coronavirus, they don't get as sick, and they do spread it, but at a much lower rate than adults. So There was a study in China that looked at where the virus is transmitted, and 96% of the time, when they contact traced the coronavirus, it was from adult to adult. So not from kid to adult or kid to kid, but passing from adult to adult. And the same in Geneva, they looked at about 40 families, and there was a small study. I think it was really interesting. They looked at 40 families and where the SARS-CoV-2 virus, how it was transmitted, and it was only, I think, 8% of the time was it from a child to an adult, and the rest of the time it was from an adult to adult. So, I mean, that's another reason why I do think we can open schools safely, because most of the passage of the virus is not happening from child to adult.
Right. So it does happen, of course, but it does
Yes.
seem that it's much less common anyway from adults to get sick from children. Of course, the people that we're really concerned about are certainly school staff and teachers who have high risk medical conditions. Certainly my concern as a primary care doctor is that would put them at risk. So we have to actually take the situation very seriously, do everything we can
Absolutely.
to prevent that from happening. But the good news is that the transmission seems to be low. That's actually a curious finding. Why would it be that kids wouldn't, like many other conditions, aren't passing it as readily to adults?
I'm so glad you asked, Dr. Hochman. There's a couple of proposed theories. Of course, we're going based on the science that we know now, so it might change over time. But one of the theories is that kids do not mount as much of an immune response when they contract the virus. So there's something called a cytokine storm, or there's a response that the immune system makes, which people can feel sick from, and kids do not mount that same response. So that's one theory why they don't get as sick. The other theory, and this was shown in Singapore when they looked at the cellular level of how the virus actually enters the body, there's a receptor. We've called it the ACE2 receptor, and this receptor is primarily in the lungs. And in children, so where this virus should enter at the receptor level, in children, there's either not that many of these receptors or they're underdeveloped. And so there's literally difficulty for the virus to enter and proliferate. And so that's also in theory why children are not getting as sick and why they're not spreading the disease as effectively. So,
yeah, it's very interesting because
too detailed, but
right.
Yeah.
In many other viruses, as you said, it's very common that opening schools has a big impact. And again, not to say that there wouldn't be an increase in cases as a result from opening schools, but maybe not as big. And if we could do everything we can to mitigate those risks. So
Right.
Given all this, it's obviously a very complex decision with value judgments involved. And I don't
Yes.
think anyone's suggesting tomorrow, with the rates going up as high as they are, but maybe when the second semester starts, should we be pushing hard at a policy level to get kids back in school?
So in my personal opinion, looking at the scientific data that we know, and admittedly, we do have 3 elementary school kids, so it probably
a little bit of bias
factors into my decision. But I do think we should open. I think for a multitude of reasons. I think one is we can get creative about how to open. Maybe start. I've seen some schools start kindergarten through second, and then increase the age as they deem safe. I think that when kids are at home, there's serious consequences. It's not just avoiding coronavirus that fares poorly for their health, but I'm seeing tons of kids suffer. I mean, really, even just this week, I've talked to families where their kids are having terrible emotional outbursts where it's leading to violence. Today, I talked to a child who's having an eating disorder. I talked to a family yesterday where their 9-year-old child has gained over 50 pounds since the start of coronavirus. A lot of depression, a lot of anxiety. And so I'm seeing kids really have a hard time. And I'm actually surprised, quite honestly, because kids are generally so resilient, but how much mental health I'm seeing, how many mental health issues I'm seeing from kids, before my eyes. And it breaks my heart because I'm seeing kids, I've never actually seen this before, where I can't get kids into to see therapists for anxiety. They're so full, they're so booked. And I really do think a lot of this stems from their loneliness, from their isolations, from their feeling of isolations. And I think it's hard for kids to be at home. I also want to comment, a lot of people will say to me, but what about the teachers and their safety? And what about the families where they have kids with somebody in their home where they could, gravely be impacted by COVID. And I just want to say, I do firmly believe that there should be options for teachers that are in those higher risk categories, the older teachers, the immunocompromised, those that don't feel safe going back to school. I think there should be an option for them to teach online. And I do also think for those families that are worried, they could also, have continued Zoom schooling. But I do think for a lot of families, it'd be great if they could have the option to send their kids back to school, because I do think we can do it safely, and I do think it's better for their ultimate health and education.